Bhatia, your friend and guide from drbhatia.com. Today we are going to discuss when you should be concerned whether your child is autistic or not. Now the research has shown that the earlier we are able to diagnose and the earlier we are able to provide an intervention to an autistic child, the better is the prognosis. So it is necessary and it is imperative that we diagnose the child as soon as possible. We get a lot of patients who come to us at a very late age, like they feel that the child is developing slowly and they do not visit the doctor till the child is 3.5 or 4 years, or sometimes even 5 years, and by that time we lose a significant amount of time which can help in improving the prognosis of the child. So it is necessary that we make sure that we are aware of the red flags, as I would say, of autism, and when you should suspect that your child has autistic features. Most of the time it is difficult to diagnose a child as autistic before the age of 2, that is 24 months, but many children show autistic features even before that, from 12 months age and 18 months age, and if you're aware, then it is possible to get a probable diagnosis and start looking for possible interventions at a rather early stage. So for this we have to understand that as a child develops, the child does not just have physical milestones. Every child, every infant has mental and emotional milestones too. Like when does a child start sitting on his own, or when does the child start crawling, or when does the child start walking, or at what age the child starts teething, at what age similarly the child has mental milestones, at what age the child understands that these people are my parents, these people are my family, at what age the child starts relating to the family emotionally, at what age the child starts expressing emotions, at what age the child starts developing command following, at what age the child starts having some meaningful to and fro interaction, at what age the child becomes playful with you. So if we understand all these milestones, then we know if the child is not attaining those milestones at a particular age, then we should be concerned. We should be going to our pediatrician or the general physician for a checkup, and if the physician or the pediatrician suspects that your child might be autistic, it is wise to go for a further and complete evaluation of the child. So what are those red flags? We'll start from 6 months age. So by the time a child is 6 months old, what is very common to observe is that the child is able to have an eye contact with the parents or the caretakers or the siblings. When you are talking with the child, or when you're talking to the child will look into your eyes and the child will smile. They'll often give you a big smile. You are talking to the child and the child will be happy, the child will smile. So by 6 months age, if you see that the child is not looking into your eyes when you're talking to the child, you are trying to have some communication with the child, but the child is looking somewhere else as if you are not talking to them. So if that is happening, and if you see that the child is not smiling, the child is not responding to your social cues, the child is not giving you a big smile when occasionally, it's not necessary that the child is smiling all the time, but there should be some show that the child is reciprocating to you at emotional level, the child is looking into your eyes, and this should happen by the age of 6 months. So if this doesn't happen by the age of 6 months, then you should consult a pediatrician or a physician. Then by the time the child is 9 months old, there is to and fro sharing of expressions. Like if you smile, the child will also smile. If you giggle, the child will also giggle, might also giggle. The child will look into your eyes. The child will have some meaningful expressions which will match your expressions. And if you see that this has not happened till the age of 9 months, the child is not looking towards you, the child is not making an eye contact, the child is not pointing towards you or pointing towards things, or the child is not smiling at you, the child is not reciprocating to you in any way on a regular basis, then that's a red flag, and you should go for an evaluation. After that, we come to a level of 12 months age. So what happens at 12 months? What we see at 12 months is that there is some babbling, along with what we have discussed for 6-month milestones and 9-month milestones. The next thing we see by 12 months, if the child is not babbling, the child is not making any sounds, then again that's a red flag. The language takes time to develop, and there are children who develop meaningful language a bit late. Especially what we see is that often male children develop some milestones later compared to the female infant. So that some social variance is accepted, but if there is no babbling at all till the age of 12 months, then that is a red flag. By 12 months, the child also starts responding to his or her name. If the child is not responding to the name, then you should be concerned. When you are calling the child by his or her name, the child should look towards you. The child should try to make an eye contact. The child should give you some emotional expression. And if that is missing, that is again a red flag by the age of 12 months. What we also see that a child by the age of 12 months is able to make gestures, point towards things. If you are pointing, he or she will also point. If you are waving, he or she might also wave. If you ask him to wave, he or she will wave. So these are small milestones which we usually see that a child develops by the age of 12 months. So if you see that if your child has not attained those milestones by the age of 12 months, then it's a matter of concern. There can be some delay, a couple of months here and a couple of months there, and that's perfectly acceptable. But if you see that these milestones are totally absent, then it's a matter of concern. So after 12 months, the next stop is 16 months. By 16 months, the child usually has some words, some vocabulary, some language development is there. And by the age of 24 months, the child should be able to speak in 2 words sentences. The 1-word sentence usually comes by the age of 16 to 18 months. By 24 months, that is 2 years, the child is usually able to speak in short sentences of 1, 2 or 3 words. And if that language development is missing, if the child is not speaking age appropriately, if the child is totally non-verbal, then it's a matter of concern and you should consult a physician or a pediatrician. So we see that these are the general milestones. At any stage, if you recognize any of these milestones, it's not necessary that you recognize the 6 months milestone at 6 months. You will probably become aware of those issues at probably 9 months or 12 months or 16 months. But whenever you see that this age appropriate milestone has not been attained, you should be concerned and you should take your child for a consultation with a pediatrician or a pediatrician or a neurophysician or a developmental physician, for a proper evaluation of the child. Along with it, now these are the general developmental milestones. There are other symptoms and signs which you might observe at any age. If you see these signs and symptoms at any age, then you should be concerned and you should think about a proper evaluation of your child. So what are these other symptoms that you should be looking for? If at any stage you feel that your child has lost what it had already acquired, if the child has regressed in any way, if the child was babbling a couple of months ago and the child has stopped babbling, if the child was speaking a few words still a few months ago or a month ago and now the child is not speaking anything, if the child was making proper eye contact till the age of say 14 months, 15 months and now the child is not making any eye contact, Any kind of regression should be an alarming sign and it should be evaluated. Along with it, if you see at any age that your child is not making an eye contact, if your child is preferring solitude, if the child is sitting alone all the time, not making any social interaction with the siblings or with the parents, or is not acknowledging anyone around him or her, like if there are guests at home or other children at home and the child is not acknowledging their presence, or the child is lost in his or her own world, sitting in one corner as if the rest of the people are not non-existent, then that's a matter of concern. There are children who are shy and there are children who are introvert, that's okay. So we do not take any one sign in isolation. If the child is autistic, you will usually see multiple red flags. It's not just one thing that will make your child autistic, that will label your child autistic. Please do remember that different children have different variability, different variance in attaining those milestones, and a couple of months here and there, that's all right. But one red flag is not sufficient. Usually, if the child is actually autistic, truly autistic, then you will see multiple deficit areas. So what are the other deficit areas? What are the other signs or symptoms that you should be looking at? A delayed development of language at any age, loss of language that had developed at any age, special behavioral patterns like hand flapping, spinning, rotating, or looking at objects that are constantly rotating, or lining up things in a particular fashion. All these are known to be associated with autism. Then if the child repeats whatever you are saying, like if you say, Adam, come here, Adam will not come here, Adam will repeat, Adam, come here. If you ask, what is your name, the child will repeat, what is your name. This is called echolalia. And if the child has this symptom, then you should look for other red flags also. Then the child often also starts walking on toes. So if there is toe walking, that is also a very common feature of autism. Then the child often has sometimes gastrointestinal symptoms, sometimes they have special behavioral symptoms. So there are tics, and there are mood disturbances, there is hyperactivity associated with some of these children. So if you see multiple such deficit areas or multiple areas of concern, then you should get your child evaluated. Please remember that no one symptom in isolation makes your child autistic. You should only be worried if you see multiple areas of deficit, or if you see multiple signs and symptoms of autism. And please do remember that apart from development of these milestones, the primary areas of concern for an autistic child is the lack of ability to form social relations, to have a meaningful social interaction, to have meaningful emotional interaction with other people. So these are the primary areas of concern, along with the behavioral issues that the child develops. And if we are aware of what we need to look for in a child, then we will be probably able to diagnose an autistic child much earlier. Please do remember that autism has become an epidemic today. The current prevalence is one child per 49 to 57 children, and we should also know that the male child is more likely to be affected than the female child. The ratio is 4:1 or 5:1, varying in different populations. So if your child is a male, then they are 4 times more likely to be autistic compared to a girl child. And so if we understand all these areas, if we understand all these deficit areas, if we understand all these developmental milestones, then it is easier for us to diagnose the possibility of autism at an early age, and treat it as soon as possible, because early intervention creates a whole lot of difference in the prognosis of these children. So I hope you have found today's video useful. If you have any questions regarding your child, if you need any help regarding autistic children, please visit drbhatia.com, and you can post your questions to me there, and I'll be happy to answer those questions for you. And make sure that you subscribe to our YouTube channel. So see you next. Thank you.